Assalamu alaikum. My name is Zubeir Husssain. I'm a cognitive behavioral psychotherapist, and today we're going to be talking about psychosis. We all have an internal voice. Sometimes that voice can be quite positive, so thinking about when we're trying to encourage ourselves in a positive way. Sometimes it can be quite negative and critical. Sometimes we're going over events that have happened in the past, thinking of, why did I do this? I could have done better, or maybe I'm thinking I'm a bit of a failure. Sometimes we use that internal voice in our prayers. So thinking about when you're talking to Allah subhanahu wa ta'ala in your prayers, in your du'as, communicating with God, that's perfectly normal. We all do this. That does not mean you're crazy or mentally ill whatsoever. Psychosis, on the other hand, unfortunately, is when you start experiencing an external voice rather than an internal voice, or when you start seeing things differently to how people may see around you, and also how you might start interpreting religious, cultural, or societal views in an extremely rigid or different way. Psychosis has many symptoms. One of the symptoms is hallucinations. What that basically means is that you might see things or hear things or even smell things differently to what people are experiencing around you. You may also experience some delusional thoughts or beliefs. What I mean by that, you might experience some rigid or paranoid ways of thinking. You might think people are against you or the world is against you as well. Unfortunately, this can lead to considerable isolation. You may become quite withdrawn and feel quite depressed, fearful, or even scared. People around you may even become quite anxious due to your presentation and due to the way you're thinking and feeling. Unfortunately, psychosis normally occurs in younger people, and younger people are typically more affected by psychosis. What we do know and what research shows, the first episode of psychosis usually occurs in your teen years, and therefore it may occur when you're around 14, 15, or 16 years of age. Also, something to think about, it can happen later on in life. Unfortunately, psychosis can be a result of other mental health problems as well, such as chronic depression, PTSD, and also bipolar disorder. Older people may also experience psychosis later on due to extreme negative life events, extreme stress, or even bereavements or trauma. Psychosis can have a massive impact on your social life. Due to the paranoid nature of your thinking, you may start becoming a bit suspicious of your family or even your friends. You might start withdrawing and isolating yourself as well. There's a lot of stigma, misunderstanding, and lack of awareness when it comes to psychosis. People might think you've gone a bit crazy, acting a bit weird, a bit odd. Some people may even think you've become spiritually possessed. And due to that, they might start stepping away from you and withdrawing from you and stop talking to you. On the other hand, alternatively, due to the paranoid nature of psychosis, you yourself may feel that I cannot start trusting others. I'm becoming fearful of others. They may do something against me, and therefore you might stop engaging with your family, friends, and start withdrawing and isolating yourself as well. What research tells us is that psychosis can be easily treated in its first episode, and this is why early intervention is essential. The health services have invested millions of pounds into different types of treatments for psychosis. The good news is, if you are suffering from psychosis, it might only just be one episode in your life. This is not a lifelong illness. Recovery is possible, remission is possible, and a combination of techniques can help, whether that's that medication or even using talking therapies as well. Often when people suffer from psychosis, the problem is they may lack the awareness and insight into knowing something's wrong with them. In their mind, they might think I'm completely fine, normal, and my thinking is completely accurate and justified. However, your family will pick up on these difficulties, even your friends may. Maybe your tutors or teachers at college or university may start recognizing something's changed here and you're not behaving or maybe performing the way you used to. And this is why it's really important to engage with your family, to engage with your friends and even your tutors at school to receive the help that you may require. As mentioned, psychosis can be treated within its first episode. What we do know as well is that there might be a genetic basis for psychosis, and also environmental factors may induce psychosis as well. There's masses of research to suggest that psychosis can be induced from drug-related use. However, regardless of what's caused it, good treatment is available and recovery is possible. Psychosis can make you feel depressed, down, isolated, and even hopeless. You may even worry about your future. You might think about, will I be able to get married ever? Will I ever be able to hold down a job? Or will I even be able to get to university if I suffer from such an illness? As Allah subhanahu wa ta'ala says in chapter 26 verse 80, and when I am ill, it is He who cures me.